You know, getting up on a Monday morning and having for 47 years had an operation to go and do that morning, and realizing I'm not going to do that anymore. You know, that's rude. It really is. And it's, like I said, there's too much time for reflection. So I go to the shop and focus on some complicated carburetor, and that helps. That helps a lot. I never imagined doing anything else, quite honestly, and I don't know why exactly. I try to put it together now and think back on interaction with the physicians here in town, old school family doctors who made house calls here in this house. I watched them come in and take care of both my grandmother and grandfather when they were in their last days. Both died in this house while being attended to by a family doctor at the bedside, basically holding hands. And I guess that's the basis of it, is seeing that interaction and saying, that's something that I really would like to do. I can clearly remember when I heard that there was going to be a hospital in Lexington. I was in Charleston, I'm in medical school, and there was a break point in my senior year where I had to make a decision about specifically where I was going to be next year. One of the local people was Dr. Cruz, who was a wonderful friend and a giver of great advice. I remember him talking to me about whether I wanted to stay here or leave. And he said, you've got, all your people are here. All the people that you grew up with, and your teachers and your friends and whatever, your classmates, they're all your people. If you come here, you have a practice. The relationship of a surgeon to a patient is probably the most intimate relationship that two people can have. It's a science, it's an art, it's got a mechanical bent to it. It's incredibly human and very intimate. One of the heroes in neurosurgery that I knew when I was in training was a sculptor. And I always heard him talk about how the three-dimensional perception assisted him or helped him in navigating his way around the brain. My mother was a visionary kind of person, and she realized some of that stuff. I didn't know how much she realized, but she insisted on my taking art from the time I was in the 4th or 5th grade. Gears and levers and all have forms, and they have shape, and their design and their interaction is a very human kind of thing. I was taught that one should fix things that are broken, and I was taught that from a little child. Oh, I couldn't have had a better career. I'm so fortunate. I don't have any regrets. I would do it all over again instantly. I would wish that kind of good fortune for anyone. We've just had a tight-knit, small sort of community hospital there. Now it's grown exponentially, just like the county has. So far it seems that the spirit is alive and well there. What I would like my patients to remember about me is that I saw them as a person, that I had some interest in them as a human being, that I asked what they did, what they liked, and that I actually interacted with them on a human basis. If I'm going to ask somebody to let me operate on them, that's the least you can do. That's the least I could offer them, is to have some insight into who they are.